Hello, I'm Josh Newman, Physician Assistant with Dr. Brett Taylor, a fellowship-trained, board-certified surgeon at Town & Country Crossing Orthopedics. With over 15 years of professional experience in workers' compensation and litigated spine care, Dr. Taylor understands the accuracy and scientific clarity required in these cases. He has created the Taylor Spine Team, which is composed of competent and considerate healthcare providers that are dedicated to providing top-tier spine care to injured individuals. Town & Country Crossing Orthopedics offers precision-based spine care, which focuses on the patient as an individual. Dr. Taylor evaluates patients from a variety of backgrounds and cultures. He works closely with patients, spending time thoroughly explaining their treatment options and always giving opportunities to ask questions. New patients will spend significant time with Dr. Taylor, Lori Burke, RN, Workers' Compensation Coordinator, and me. We focus on patient expectations and accountability. Prior to surgery, a timeline is signed by the patient outlining expectations, expected return to work, and maximal medical improvement. Through an evidence and precision-based medicine approach, our work speaks for itself. Thank you for watching. Dr. Taylor will be speaking next on a topic important to us at TCCO.
Hello, I'm Dr. Brett Taylor. Back pain, which is a symptom, not a diagnosis, is the most common workers' compensation claim in the United States. Similarly, disc degeneration is not a disease, but a normal part of the aging process. As we age, the disc undergoes chemical changes. I explain to my patients that the disc goes from being like a grape to a raisin. The disc dries up. Cracks develop in the covering of the disc. As a result, the disc loses the ability to carry the stresses of the spine. Therefore, individuals may have disc degeneration with a herniated disc and be asymptomatic. As a result, non-operative treatment is often the first approach to spine treatment, and surgery is performed as a last resort. 1/3 of asymptomatic people under 60 will have on their lumbar spine disc degeneration on an MRI. 20% will have a disc herniation. 25% of asymptomatic people under 40 will have cervical disc herniations or stenosis on an MRI. In work comp patients, the results of surgical and non-surgical treatment are worse than those of non-work comp patients. Work comp status is an independent risk factor for unsatisfactory results after all treatments. The reason for this is unclear. A number of factors have been hypothesized, including injury severity, psychological or psychosocial factors, and the potential for secondary gain. Spine data describes lower return to work, less release of symptoms, lower satisfaction, lower improvement in quality of life, and more likelihood to receive long-term disability when comparing work comp patients to non-work comp patients. As a physician who treats patients with workers' compensation, I must be aware of this data regarding work comp surgical results. Another major risk factor for poor surgical outcome is psychological disturbance. Therefore, it's important to preoperatively screen for psychological overlay prior to performing certain elective surgical procedures, realizing that patients with psychological issues can still have a spine injury. Finally, the use of opioids prior to surgery is a significant risk factor for a poor outcome. For this reason, individuals undergoing elective spine surgery should discontinue opioid usage prior to proceeding with spine surgery. Disability rates increase in conjunction with preoperative opioid use. At TCCO, I carefully assess patients on an individual basis and make determinations about their surgical treatment based on individual factors, not simple generalizations. Ultimately, each patient's medical situation and outcome is unique, and optimal results require proper patient selection, appropriate surgical indications, and optimal surgical skill and technique. In my practice, I have tracked the results of my surgical treatment in a database using standard outcome measures, and I have found successful treatment in the complex arena of work comp. 30% of my patients treated are obese, and almost 40% abuse nicotine. Even with these risk factors, my patients have had significant improvement in postoperative outcome, and successful return to work. At TCCO, we focus on workers' comp, offering specialization in this complex arena. Successful treatment requires an attentive staff who's appreciative of the complexities of work comp cases. Precision spine care requires the surgeon to identify the structural cause of a patient's symptoms prior to a surgical intervention. This identification is best done through a thorough clinical history, detailed physical exam, diagnostic imaging, and assessing their response to non-operative interventions. When these parameters align, the surgeon can zero in on the precise diagnosis and improve surgical outcome.
Hi, I'm Alyssa Visconti, Administrator at Town & Country Crossing Orthopedics. In addition to orthopedic spine surgery, Dr. Taylor also offers supplementary services, such as IMEs, chart reviews, and case evaluations. New patients, as well as IMEs, can expect to be seen within 10 business days of request and finalized notes completed within 5 business days. Every effort is made to maximize appointment efficiency. We also offer day of appointment work status reports and immediate accessibility to Dr. Taylor and his staff through numerous channels. At Town & Country Crossing Orthopedics, case managers are welcomed. We offer an inviting case manager lounge. To experience better spine care, contact Town & Country Crossing Orthopedics. Watch for our upcoming videos in this 12-part video series, and thank you for watching.